Welcome back to Gastro-oesophageal reflux disease. Today we'll talk about the possible investigations that one may have either leading up to surgery or to assess the degree of inflammation. These commonly include gastroscopy and esophageal physiology. Gastroscopy involves looking down the esophagus with a flexible camera when the patient is under sedation. This allows the specialist or the surgeon to assess the degree of inflammation, any complications, and to confirm the reflux if at all it is present or not, and also to rule out any other pathologies that might be responsible for reflux. Esophageal physiology is a combination of essentially two tests. Both of these include insertion of a thin catheter through the nose that sits in the esophagus and takes various measurements. One of them, known as 24-hour pH study, takes measurements mainly in relation to the severity or the degree of acid reflux and the frequency of acid reflux. The other one, known as manometry, measures the strength at which the esophagus contracts, including the valves at the bottom and the top of the esophagus. Now, these tests allow a specialist to assess the degree of inflammation and tailor the treatment to make sure whether the medical treatment is appropriate or they need any surgical form of treatment, and also to tailor the surgical operation if need be. Thank you. Next time, we'll talk about how to avoid or minimize the reflux.